Your visit for an evaluation for an asbestos-related disease has a number of parts. First, we'll meet you at our office at the Center for Occupational and Environmental Medicine and perform a history and a physical exam. We'll ask you about exposure histories, we'll ask about how you feel, we'll ask about family histories, we'll ask about anything that seems to be related to the complaints that you have. And we'll do a physical exam. We'll listen most carefully to your heart and lungs. We'll look in your throat, we'll push on your abdomen, we'll check your pulses, we'll do the things that you would expect a doctor to do, looking for an asbestos-related disease. We'll also do a pulmonary function test. Now, many people think a pulmonary function test is adequate when performed by blowing into a small tube 3 times and you're sent on your way. That's really not adequate for a thorough asbestos evaluation. We'll do a complete pulmonary function test, which includes sitting in a plastic box and measuring lung volumes, as well as the ability of the air to cross over the lung into the bloodstream.
Among the most important things that we do at Karmanos is research. As part of your visit, we'll ask our research assistant, Cindy Norian, to speak with you about participating in some of the various research programs that we have going on. And among the most important things that insulators can help with is discovering new methods to help us discover cancer early, before it takes hold and before it's too late to do anything about it. So we'll ask you to participate in research, hope you'll understand that it's a no obligation sort of a thing, and help us discover a cure for cancer early. If you have findings on your physical examination or in the pulmonary function tests, which appear to demonstrate asbestos-related disease, we will want to get a CT scan of your chest done at the main campus of the Karmanos Cancer Center, located among the facilities of the Detroit Medical Center in Midtown Detroit. Among the reasons that we want to do the CT there is that we've been able to develop some radiographic approaches called radiographic imaging techniques in CAT scanning, which are really quite unique and help us visualize the things that are going on in your chest better than other methods.
Now, the CT is better than an X-ray to find abnormalities related to asbestos. And we particularly like the high-resolution CT, which is also sometimes called the 64-slice high-resolution CT. This is a piece of equipment that looks at the substance of the lung and magnifies abnormalities significantly. Now, many of you have heard that CT of the chest or CAT scans of the chest increase your risk of cancer. A recent study by the National Cancer Institute and the experience of many, many physicians all over the world for a number of years has been that early detection saves lives. And the earliest detection mechanism around is the high-resolution CT. The data has shown that the risk of being harmed by the radiation of a type of CT after the first high resolution is performed, called a low-dose CT, is much less than the risk of dying from cancer. So we're going to want to do a very detailed CT for your first visit or two, and then we'll drop back to the still much more detailed than a chest X-ray CT, but much lower radiation. And then because the people who have asbestos exposure have about a 200% increased risk of getting colon cancer, we're also going to recommend that you see your family doctor to be referred for a colonoscopy. Now, as an honest matter, this is never going to be made into a ride at Disney World, but it's not that bad. And I'm telling you from the perspective of not only a guy who's performed colonoscopies, but also a guy who's had a couple. What happens is you go to the doctor, you then are given a prescription to cleanse your colon, if you will, with a particular sort of set of medications. And then you go into the outpatient area of either your local hospital, or we can help arrange it here in Detroit, where a tube is inserted into the rectum and you're examined. Now, I will tell you, you don't have to do this to be checked for the other forms of asbestos-related disease that occur in the lungs. But because colon cancer is the second most common killer of men and women over age 50, and because people who have asbestos exposure have 200% the risk of getting colon cancer over the rest of the population, we really think you should get one. But for those who have some sort of conviction against this procedure, we won't exclude you from the remainder of the evaluation because you don't want to get it. But you should get it. And then what we'll do at the end of your evaluation is we'll go over your CAT scan results with you, If we've had to draw any blood work, we will. If we've had to do an EKG on your heart, we will. And we'll go over your pulmonary function tests. We do this at a visit which we like to call the wrap-up. It's usually at the end of your second day with us. Sometimes we can do it at the end of the first day if everything goes great. And we'll explain to you what you need to be worried about, what you don't need to be worried about. We'll prescribe medicines to help you breathe if it looks like some are available. And I want to tell you, when I was in my training program to become a specialist in this field, sometime in the last century, we were taught that there wasn't that much you could do for people with asbestos-related disease. What we have learned in the meantime is that there's an awful lot that a skilled, trained, and educated physician can do for someone with asbestos-related disease. There often are components on the breathing test which can be treated with medications which make it easier to breathe. There often are cases where people are really short of breath, where supplemental oxygen can be very helpful. But the mainstay of what we do to help people who are not horribly ill, but who are ill enough to become short of breath, is prescribed medicines to help with the breathing. We also keep a very close eye on the cancer sites for cancer surveillance, because if you get a cancer, you want to catch it early. This pretty much sums up what we do at your visit for an asbestos-related disease evaluation here at the Karmanos Cancer Institute. I do want to tell you that we appreciate very deeply the support of the Breath of Life Foundation for our work. Among the things that we've done is taken CT scanning and what is called imaging of the chest to the next higher level for asbestos-related diseases. We've discovered here at Karmanos one blood test which is an early predictor of mesothelioma. We field tested another blood test which is an early predictor of mesothelioma. We've discovered why some people have horrible, intractable pain from pleural plaques, and we're actively working on organizing a tissue bank and a database with our colleagues at Mount Sinai under the direction of Dr. Steve Levin. You'll see that some of the CT approaches that we're using actually look like photographs of the lung rather than the old black and white rendering of images that it took a radiologist to figure out. So thanks for your attention. Please call us if you have questions. We'll be very happy to see you in Detroit and hopefully help you live a longer, healthier, and happier life. And remember, this is very important, that the diagnosis of asbestosis, the diagnosis of an asbestos-related disease, is not a death sentence. People live years, there is hope, and they can live very well with the appropriate medicines. And in the case of people who do get a cancer, we work at catching it early and doing as much as we possibly can to get rid of it before it ends the patient's life.